This is an interesting case of a patient that I have that has Ehlers-Danlos syndrome. Their main symptom complaint is chronic neck pain, but there's also a history of headaches and also migraines. I wanted to do this video to demonstrate some of the interesting features of the cervical spine. So this here is a sagittal view of the spine where this is the front, this is the back, so kind of like a profile view. You can see the jaw right here. Again, this is the posterior aspect of the cervical spine. These here are the vertebral bodies. So and then between them are these discs, which are the vertebral discs or the cushions of the spine. Now this white space here defines the spinal canal. And I think of it as like an elevator shaft. Down the center here is the spinal cord. Now, in general, I'm looking for evidence of a disc herniation, some sort of impingement of a neural structure like a nerve root or the spinal cord itself. Everything looks fine from that standpoint, but what is interesting is that the general size of the canal is fairly wide, and this is a typical finding I see with people with suspected connective tissue disorders. So outside of disc herniation and neural impingement, everything actually looks pretty good. The canal here is generally wide, which is a feature, but what is also interesting is how straight the cervical spine is. Normally there's a little bit of a cervical lordosis, so the curve kind of goes this way, where the concave side is on the right side. But as you can tell here, these building blocks are stacked essentially directly on top of each other.